All right, welcome back to the Atlanta Dental Spa podcast. So for over 20 years, we've been the go-to practice in Atlanta for comprehensive and cosmetic dental treatment. Our mission been quite simple. We want to lead with a dental experience through comfort, compassion, and expertise. Today, I'm sitting back with Dr. Gandhi, and we're going over kind of part 2. Last time we were here, we talked about the 10 most commonly asked questions in dentistry, right? I scrubbed the internet, found them. Today, we're going to quickly talk about the top 10 fears of people in dentistry. And we're going to talk about the fear, and then we're going to talk about kind of what we have done as the antidote for that, right? Because we all know that going to the dentist, like I just went through the dentist the other day, downstairs here at Atlanta Dental Spa, had to have an extraction, right? Was I a little nervous? Yeah, of course, I'm human. Like, you know, everyone's a little nervous of going to the dentist. So 20 years ago, Atlanta Dental Spa was founded as a spa because everyone likes going to the spa. And so we focused on the 5 senses, right? So we focused on how does it look, right? How does it smell? How does it feel? Do you hear any scary noises, right? And so we've created an environment to abate all those scary things. So I'm going to quickly go over the top 10 fears. So the most common fear of the dentist is fear of pain, right? And so why is that the big fear? And I think some of it too stems from childhood, right? Like I think dental care was probably not as compassionate back in the day as maybe today. I don't know. I've just heard that people have some childhood experiences that are kind of scarred them. So fear of pain, like how is that abated?
You know, I mean, pain is real. And as a provider, we have to listen to our patients and understand when people are feeling pain or how they're experiencing pain, because you know, and sometimes we have to put ourselves in that position.
Yes.
So we have to be patients too.
Yes.
And to fully understand it.
But so why does everyone complain about, tooth pain's a whole different thing, right? So is there just more nerves, more innervation? Like what's going on with why is our mouth so sensitive?
It's so close to our brain. You know, like if you think about, there's a lot of nerve endings in the head and neck.
Yep.
The pain can lead straight to the top part of the head. And, you know, if you get headaches, next thing you know, you've got tooth pain and that headache won't go away. And it becomes debilitating for a lot of times. You know, I've met many women that have had children that say that tooth pain is worse than
I've heard that too.
Giving birth.
Yeah.
And
so were the anesthetics, the numbing gel? I mean, I'm sorry, the shots, the anesthetic. Were they less effective years ago? Like, has there been advancements in that? Because you always hear about it, and I think a lot of pain comes from not being proficiently numb.
Right. I do agree with that.
Or profoundly numb, I should say.
Profoundly numb. I think that the techniques have definitely improved. Okay. I think that there's definitely an increase in compassionate providers.
Okay.
We're also using better products. You know, for example,
like scientific advancements in the products themselves.
Well, like, you know, just using like topical gels before we actually place the local anesthetics. You know, we're using something in our office that's compounded by a pharmacy. So it's way more effective.
So you don't feel the initial
and
shot.
And you don't feel it. Right.
Because you're super numb. That's cool.
You're super numb. So we're just using little techniques here and there to improve the experience of receiving shots.
But I think back in the day there was like only lidocaine or something, or Novocaine.
There was less options.
Yeah, and now there's there's science with getting more numb, right? And so, I think so many people are just scarred by having like, oh God, it's gonna hurt. I'm getting ready for it. But so it shouldn't. I always say, to patients, like if something hurts, like A, say something, and B, like, not something is wrong, but like you may not be numb enough, right? It may have missed that nerve or something. So, it's like feel something, say something kind of thing. Okay. All right. So next is fear of the needles. Yeah, that's a very rare. Can you watch yourself get a needle, like blood draw?
I still get squeamish.
I can't watch it. I can't watch it. But I could numb myself. But I couldn't watch it. I couldn't do that for sure.
It's that's a tough one. It still gets me. But it's a real fear, and we have to respect that. And so when we're doing local anesthetics, we try to find different ways to
So you mentioned the topical, right?
right.
So
There's the
what else?
topical.
What else could be?
We have sedation too.
Well, wait, but let's stay. I want to stay on the fear of the
Okay.
injections for a
So
second. 'Cause we'll get to that.
we usually give patients sunglasses during the procedure, so it kind of dims the lights. We also have TVs so they can be watching.
That's all
something.
the comfort. That's all
Okay.
the comfort. I'm not trying to step on you, but where I'm trying to get from you is that a lot of times the needle there are different gauges of the width
Right.
of this needle, right? So the big one, right, is a 25 or 27. It delivers a lot of anesthetic very quickly. And what I have seen, unfortunately, in our profession is that it's a speed of, they use a very big needle when they don't really need to be using something that big. So obviously, when you don't have numb gum tissue and someone brings out the largest size needle, well, of course it's going to feel. So we have actually made a science of that, and we use like kind of the smallest gauge first in order to deliver that anesthetic, because it, like you said, we've
Right.
all been recipients of dental care. So like
Yep.
I would much rather have a little baby one first so I don't feel anything.
Yeah.
Right.
Using a small one first, using a really, really small comfort. We'll call it a comfort gauge. And so it's designed for patient comfort.
What's that?
Just a really a lot smaller gauge needle.
Oh, okay. The comfort
Yeah.
gauge needle you're saying.
Yeah,
Got
comfort
it.
gauge needle, we'll
Okay.
call it. And also just delivering the right types of anesthetics to allow.
And you see in the movies, like people will like wave the needle and stuff. And I think there's like a emotional trigger that happens even when you see it. So like we make a science of like kind of being like, not to like a sneak attack, but like definitely don't try to draw visual cues of like, oh shit, here it comes. Right.
And
just kind of out of sight, out of mind. Let's get it done.
yeah,
Right?
that too, and breathing exercises. So my assistants will always help when we're right when we're about to give anesthetic. We'll have the patient start breathing a certain way. So
How does that fix their their fear needles?
Well, it reduces the pain threshold, so their fear
Oh.
it creates a positive experience. So if they don't feel it as much, then the next time they have it, they'll be like, "Oh yeah, I got this. This is good. I can do this."
So this
Baby
kind of
steps.
piggybacks on that, which is like fear of the anesthetic not working. And I want you to kind of talk about the reasons for this. And I think there's two. One is because you just kind of wrong location for the nerve, right? Which happens to all dentists.
Right, yeah.
And two, maybe like talk about like the flight or fight kind of situation, right? Where your body is defending itself from.
Yeah, I mean,
So this is about, again, the question is, I have fear of the anesthetic not working.
that can happen sometimes if we're not able to numb the patients. And I usually try, 2 or 3 times. But if I can't get a patient numb, which doesn't happen very often, but I definitely say, you know what, let's call it a day. We'll reschedule. We'll bring you back. And we'll try this again.
Okay.
So we don't want to overwhelm people. We also don't want to give them too much anesthetic because that could increase the heart rate just with the epinephrine. That's
Right.
those in those.
Right. So if they're already
anesthetics.
coming in, all right. So let's just say hypothetically, I'm petrified of the dentist. Don't want to see a needle, right? And if I see it, now I'm in this. We all know what like that flight or fight reaction is, right? When we've been scared or spooked, and our eyelids, our breathing increases and our eyes dilate, and we're ready for that danger, whatever it may be.
Right.
When your heart is racing, I think that your body defends against it. Like, what is this
Yeah.
foreign thing?
It makes
Don't-
it harder for it to work.
It makes it harder for it to work. Yeah.
Yeah.
And so I think that's where, like, I want you to, at some point, we're going to talk about how IV sedation has really helped with that. And it's kind of geared for that because there's different levels of, modern dentistry has different ways to kind of mitigate against all the things we're talking about, right?
Right.
The pain, the injections, the anesthetic not working, fear of the dentist through bad experience. So that this may be a good time to talk about the person who is just debilitated by fear.
Right.
And I think a lot of them just say, you know what, I'm not going ever because I remember what happened last time, so to speak. And so talk about the help for that person that may be listening to this and saying, show me why I should come off the sidelines kind of thing.
Right. We have one of the best solutions for high anxiety patients. and it's IV conscious sedation, where we can start an IV and push some medications, allow patients to fully relax, and they're hooked up to a monitor, so we're monitoring their vitals at all times. But it works better than anything else out there in the sense that there is a lot of people will call sedation oral sedation, right?
Yes.
So they'll
Big
just be
misnomer.
pills.
Yeah.
They'll take a few pills before they come in, an hour before.
Like
they'll
a
bring the pills
Xanax,
with them.
like a benzodiazepine, Xanax or a
Xanax,
Valium or
Valium, Ativan, a Halcyon. Those are all different ones.
So talk about the level. Let's talk about the levels of numbness or anesthetic or sedation. So first you would just have what we just talked about, just basic anesthesia, nothing else.
So just local anesthetic.
And then what would be the next thing that you would add to that? Would it be
nitrous?
Nitrous. So nitrous oxide.
Yeah, nitrous oxide. It elevates the it adjusts the pain threshold, so we don't feel pain as much.
Okay.
It also kind of takes the edge off.
What would be another increase from that? Would be like you maybe the pill you talked about.
Yep. And then after that would be taking an oral pill. Say, if you have a real fear, we could prescribe you a pill that you could take before you come in.
Okay.
So you have something in your system that's allowing you to relax and be a little bit more open and receptive to the type of things that are going to be introduced.
And then the Cadillac treatment of dentistry, which have experienced, and it's you wake up and wonder like, we're already done.
Yeah.
Is the IV sedation like you spoke about.
sedation.
How many dentists, and I think Dr. Curry gave me a statistic, but how many dentists, first off, all 5 Atlanta Dental Spa locations have IV sedation, but how many dentists in Georgia, as a percentage, can do IV sedation?
It's only about 3 to 4%.
3 or 4%. So when a lot of times people see like, oh, we do sedation dentistry, they're typically talking about the pill, right?
They're typically talking about the pill, but they're not actually
the pill, meaning the Valium,
an oral pill that
the
you
oral
can
pill,
take.
right?
Yeah.
So that's not true. That's not sedation. That's just anti-anxiety.
It's really more anti-anxiety.
Got it. Okay.
But the IV sedation is really
it does work wonders,
and it's something that's really safe too. Anybody that comes in, especially if they're medically complex, if they have previous heart issues. The safest way for us to do dentistry on them is by sedating them.
Because going back to that kind of that fight or flight, you're saying that if someone comes in and they've already got a heart problem, now they're super scared now you give some anesthetic that is it's a dangerous situation.
It's a dangerous situation. And that's why we always take blood pressures too when patients come in. Before we do any kind of injections or, treatment, we always take a blood pressure and heart rate to see where they are baseline.
So cool. I will say, anytime you get offered sedation through IV sedation, you should do it. If you
sign me up,
I'm telling you,
sign me up.
It's like it's a gift to dentistry, especially when you have comprehensive dentistry that needs to be done. Meaning a mouthful of, let's say, you're fixing crowns or a bunch of fillings, or you're getting cosmetic work done, or all on it. There's so many things that we do here that are very complex that definitely warrant that. But look, even have you ever had someone that's like, I can't even get a cleaning. Like, if you had someone that's like, I need to get sedated to have a cleaning even?
I have a few patients actually that are on the schedule now. They need to be sedated for all of their treatment. Everything, even x-rays and diagnostic information. And then we're going to be doing same day dentistry at the same time.
So you do a lot more in that procedure and you bang it out for them. That's awesome.
Yeah.
But like what a godsend to have, that available, so that like it doesn't leave people and just like, I'm never going to go, because we all know that leads to, like we talked about on the last pod, like tons of body problems as well, health problems. Bless you.
Excuse me.
All right. So here's another one that's ranked pretty low, but it's fear of noise. And I think it's that drilling, right? And it's the high pitched, the whine that we all know. We see it in the movies. I think Hollywood's done us a disservice, by the way, but we hear that high pitched noise, which a lot of times we do not have at ADS, right? Because there's advancements in the actual drills themselves, which I know that's super boring to be talking about in a pod, but there's electric hand pieces versus the air driven. The air is the one, they have that
really
high pitch,
high RPM
and it kind of, it hurts your
It's
ears
ringing.
almost. Yeah. But regardless, we've mitigated a lot of that. We've thought about that. We've been patients with all the offices have noise canceling headphones, which actually take that same frequency and try to cancel it as you're watching your Netflix.
Yeah.
Which is really cool, right? So some of these fears, I guess, that people have ranked on the internet are easy to surmount. Others are a little harder, right? But it can be done through IV sedation and stuff like that. Fear of smells. Obviously, there's that. Do you know this is a quiz? This is going to maybe age you or not age you as a practitioner. What is the smell that triggers people? What is the compound called that triggers people to freak out when they smell it in dentistry?
Oh man, is it the eugenol?
Eugenol, you got it. All right, proud of you.
It's like a clove smell.
The clove smell, right?
Yeah.
So it's that smell like that. I think it was associated with it was in almost every material that was used, and whenever people smell it, it triggers that.
Yeah.
You never, and unfortunately, our senses can take us back to that location. So if you see something, obviously it can trigger you. If you smell something, sometimes it can take you back to that childhood experience where you're like, oh no.
Yeah, you don't want
We're not
that.
doing this again, right? So I actually remember when ADS was started out, I remember we had the option to kind of bring that material in. And once you bring it in, you can almost never get rid of the smell. I was like, we're just not ever bring that in because it'll trigger way too many people. Okay.
Good call on that.
And thank you. And then fear of diagnosis is listed as the last thing, meaning they're going to get bad news. I'd rather stick my head in the sand than hear what you have to say. I don't want to hear what you have to say, kind of thing.
I think that a lot of our I would say all of our providers are very compassionate in that sense, because not everyone wants to hear bad news, but what they do want, what we have to reassure people is that, listen, yes, this is not a great situation, but we can help you get through it, and we're going to be guiding you the whole way. And it's a tough conversation sometimes, especially with somebody who is highly anxious.
Yeah.
And then they hear about something that they don't want to hear.
What I've seen too is that bad news gets worse with time, right?
Yeah.
And where I'm going with that is something that could have been like, yeah, we need to have this crown or whatever. As now it's, if you wait and you delay and you think that it'll go away, sometimes that bad news, which would have been bad, is now far worse from waiting. And so I guess the advice would be to someone who's like, I'm a fear of bad news. It's like, I don't know. What I'm trying to say right now.
It gets more expensive too.
It gets more expensive. And
that's the biggest thing.
Complex.
It's like it gets complex. It gets more expensive. So when a small problem becomes a big problem, it hurts the pocketbook. It hurts.
And it's so frustrating for the patient. They're like, I should have just come, it's like you hear that, should have just come in years ago and it happened. Or should have, and it's like this instant regret.
Yeah. A lot of patients will say, I wish I found you guys earlier.
Yeah.
That's a tough one too.
I'm going to end with this on the top 10 dental fears is that, I think dentistry has made so many advancements towards the patient comfort, right? And I think that there are practices out there who are giving great names to the modern era of dentistry. And I think, unfortunately, there are practices who are not focused on that patient comfort or, like you said, being compassionate. And I'm not throwing shade, but like dentistry, we've almost alleviated, and we kind of went through that list, we've almost alleviated every problem that someone may have.
Yeah.
And if you're sitting on the sidelines and you're wondering like, hey, my last dentist, and you haven't given Atlanta Dental Spa a try, I encourage you, come in and see what modern dentistry is all about. And check it out on the website for sure. So once again, Doc, thanks for the questions and the me grilling you, and we'll see everyone next time.
All right. Take care.